In this video by deck plate, we will understand the VA disability ratings for muscle injuries, the shoulder girdle and arm. Extrinsic muscles of the shoulder girdle: Trapezius, Levator Scapulae, Serratus Magnus. Extrinsic muscles of the shoulder girdle: Pectoralis Major II, Costosternal, Latissimus Dorsi, Teres Major, Pectoralis Minor. And rhomboid, intrinsic muscles of the shoulder girdle: Pectoralis Major I, Clavicular, Deltoid. Intrinsic muscles of the shoulder girdle: Supraspinatus, Infraspinatus, Teres Minor, Subscapularis, Coracobrachialis. Flexor muscles of the elbow: Biceps, Brachialis, Brachioradialis. Extensor muscles of the elbow: Triceps, Anconeus. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The VA evaluates shoulder girdle and arm injuries based on the muscle groups involved, their function, and the severity of the injury. Ratings differ for the dominant and non-dominant arms, recognizing that injuries to the dominant arm may result in greater disability. Group 1: upward rotation of scapula and elevation of arm above shoulder level. Diagnostic code 5301. The muscles involved in this group are the Trapezius, Levator Scapulae, and Serratus Magnus. These muscles function to rotate the scapula upward and elevate the arm above the shoulder. Severe, 40% dominant, 30% non-dominant. Moderately severe, 30% dominant, 20% non-dominant. Moderate, dominant, and non-dominant 10%. Slight, dominant, and non-dominant 0%. Group 2, depression of arm and downward rotation of scapula. Diagnostic code 5302. Muscles involved in this group include the Pectoralis Major II, Costosternal, Latissimus Dorsi, Teres Major, Pectoralis Minor, and Rhomboid. They are responsible for lowering the arm from an overhead position to the side and rotating the scapula downward. Severe, 40% dominant, 30% non-dominant. Moderately severe, 30% dominant, 20% non-dominant. Moderate, dominant, and non-dominant 20%. Slight, dominant, and non-dominant 0%. Group 3, elevation and abduction of arm to shoulder level. Diagnostic code 5303. This group includes the Pectoralis Major I, clavicular, and deltoid muscles. These muscles help to elevate and abduct the arm to shoulder level and work with other muscle groups to swing the arm forward and backward. Severe, 40% dominant, 30% non-dominant. Moderately severe, 30% dominant, 20% non-dominant. Moderate, dominant, and non-dominant 20%. Slight, dominant, and non-dominant 0%. Group 4, stabilization of the shoulder. Diagnostic code 5304. The muscles in this group include the Supraspinatus, Infraspinatus, Teres Minor, Subscapularis, and Coracobrachialis. These muscles work to stabilize the shoulder during strong movements, abduction, and rotation of the arm. Severe, 30% dominant, 20% non-dominant. Moderately severe, dominant and non-dominant 20%. Moderate, dominant, and non-dominant 10%. Slight, dominant, and non-dominant 0%. Group 5, flexion and supination of the elbow. Diagnostic code 5305. This group includes the biceps, brachialis, and brachioradialis muscles, which are responsible for flexing and supinating the elbow. Severe, 40% dominant, 30% non-dominant. Moderately severe, 30% dominant, 20% non-dominant. Moderate, dominant, and non-dominant 10%. Slight, dominant, and non-dominant 0%. Group 6, extension of the elbow. Diagnostic code 5306. Muscles in this group include the triceps and anconeus, which allow for elbow extension. Severe, 40% dominant, 30% non-dominant. Moderately severe, 30% dominant, 20% non-dominant. Moderate, dominant, and non-dominant 10%. Slight, dominant, and non-dominant 0%. Veterans with injuries affecting these muscle groups should seek appropriate medical evaluations to document the degree of impairment for accurate compensation. Thank you for watching this video. Please don't forget to subscribe and like our videos.